Hi, everybody. Welcome to GW Center for Integrative Medicine podcast. I'm your co-host, Dr. Kogan, Medical Director, Associate Professor of Medicine at GW. Please do subscribe to this channel, to this YouTube channel if you like this. I'm going to try to make this video short. In the last couple of weeks, I had several of my patients end up in emergency room. Some of them were admitted to the hospital, and unfortunately, there were different hospitals. I'm not going to name the hospitals, I think that's not really relevant. But the waits in the emergency room were especially long. In fact, in 2 cases, patients left emergency because after 14 hours of wait, they felt it was inappropriate. They haven't been seen yet. It seems like this is becoming an increased problem in the inner cities and larger urban areas. And I had quite particular concerns about one patient who looked really sick. I couldn't examine him. We had to end up sending him to emergency room this way. He's an older gentleman with multiple medical problems. And it spiked not just my interest to sort of look into literature and say, that there's a problem, but also to actually try to put some perspective on this. And I think this is very relevant to anybody who's over 65. Emergencies happened. You can be very healthy 70-year-old, let's say, and end up with some kind of an acute problem that will end you in an emergency room. And so the practicalities of this video, after I present a recent JAMA article, is gonna lie around how do you navigate the situation, sort of what do you do if you have to go to emergency room, but you're concerned about what could actually happen, which would be a bad care. I mean, in essence, this is what this is. And again, I'm not trying to blame the system or particular hospital for anything. I'm just describing what we have. And so don't blame the messenger here, but it's not good. So let's look at this particular study. So as usual, I'm going to go ahead and share my screen with you. And I'm not going to show you the full article. If you really desperately want to get it, you can. You'll need to obtain it. It's a subscription through the JAMA. So the title of this article was just recent. This is November 6, 2023. It's Overnight Stay in Emergency Room Department and Mortality in Older Adults. So in essence, it's a French cohort. I guess it doesn't really matter where this happens. It's probably going to be true in any situation. So they took patients who were older, so not just geriatric, but older, so 75 and older, who spent a whole night, so at least 12 hours in ED. And what they basically showing that in this scenario, there was a dramatic increase in mortality and morbidity. So if the patients had to be in emergency room for more than 12 hours, and this is the data, patients who spent the night, so 12 hours more, in ED had a higher in-hospital mortality rate of 15.7 versus 11%. So this is a pretty big difference here. It's actually almost 40% higher mortality rate, despite the fact that patients got admitted to the hospital. So if they just left the hospital, you would worry that the mortality would potentially be even higher theoretically, although obviously if patients getting admitted to the hospital, they're sicker. There are also higher adverse events, so by 24%, and a longer stay. So they stayed an extra day on average compared to those who got admitted quickly. So, what does all this mean? So how do you put this in perspective? Well, clearly, if the hospital is overrun and you're going to sit in an ER because the hospital is full and emergency room is too busy to sort of take care of you, you shouldn't be there. I mean, this is how this reads. Now, if you're in an area where that's the only choice, well, obviously, I think you should stay there. But if you have a choice, you should try to risk stratify and go to a place that has a faster processing. Of course, it's more complicated. I mean, what if all your doctor's team in that hospital and you have to wait? What if your condition can only be treated in a given healthcare system in a given hospital? Okay, well, then you would go there. But for something that's relatively benign, and I'm going to use this real case, which we were concerned about infection or like a kidney infection. Turns out this was a kidney stone, was not really an infection. And so it wasn't actually all in all kind of the most life-threatening emergency, but it was very frustrating and not just frustrating, but scary. I mean, you're not seen, but after 12 hours, you're continuously in pain, no tests done, you just sit there. Like, why would you sit there? You could sit at home, So in this scenario, it's pretty obvious that you have to try to figure out what hospitals are full. So here it gets a little sticky, at least in US. I mean, if you're in another country, I'm not exactly sure how it's done. But if you call emergency service, you call 911 in US, the ambulance will take you not just to the nearest hospital. They're supposed to take you to the hospital that has the least amount of busy, that has the most open space in ER and can admit you at least to emergency room right away. Now, you could, of course, if you feel like getting into the car and driving, you can get to the hospital yourself, which will save you an ambulance bill potentially, and just also make it a little less panicky and a little less anxiety provoking. But then you won't know what's going on in that emergency room. So you could potentially ask, if you have a good relationship, if you have a concierge doctor, if you have a very good relationship with primary care doc, call your doc and see if they can call the emergency room. Because if you call emergency room, nothing's going to happen. They're not going to tell you that they're full. But if your doctor calls emergency room, particularly emergency room where a doctor has a privilege, you may have some information. I was not generally doing this in the past because what just happened in our system was quite unusual. I've never encountered this particular situation before. And of course, I'm going to try to find out what happened. And, I already contacted some of the leadership and just to sort of find out what can be done. I mean, in situations like this, should we just be diverting patients elsewhere right off the bat? Because we know that the care is going to be worse and the outcomes potentially worse. We have a data for that. So yeah, I know it's a difficult topic. You may not have learned here much, but it's a thought-provoking and also hopefully will help you to navigate the system somewhat better. Okay. I'll probably do one more video before New Year, but otherwise, Merry Christmas. I'm probably not going to record anything new until after the Christmas or between Christmas and New Year's. And so, yeah, enjoy festivities and happy upcoming year. And we'll see you soon, covering all the topics of integrative medicine, health, wellness, and longevity. Bye.